You're still watching the AM show here on your Joy News channel on Multi TV, and today quite a number of things obviously are happening. We told you we'll be bringing you a lot more comprehensive things on this very platform, and news just coming in suggests yet another group, a group of nurses are planning on picketing at the Flagstaff house later today. They also seem to have quite a number of concerns, issues with government and how it has handled a few things, particularly their recruitment into the service. But we'll be bringing a lot more on this in a short while. Benis Abubedu has a lot more details, and we'll be sharing that with us shortly. Benis?
So we have the leader of the Coalition of Allied Health Professionals, Pascal Al-Hassan, to talk more about this and really what their concerns are. Thank you for joining us, Pascal. How are you?
Thank you very much. I'm good, my sister.
All right. You're coming all the way from Kintampo. What are your concerns?
Basically, we are graduates from College of Health and Wellbeing in Kintampo. We are bonded, trained health professionals who are supposed to be absorbed by the government right after our training. But as we speak now, we've gone through all the necessary requirements that are supposed to ensure our postings to various health facilities across the country, but that is not being done.
And so that's why you've decided to come to Accra. How many of your colleagues are joining you in doing this?
We are about 500 in number, and let me be quick to note that we are a special group of health professionals. Of course, it is only in Kintampo, in the Brahava region, that our crop of health professionals are trained. If you remember, until the inception of the University of Health and Allied Health Sciences in UHAS, it was only in Kintampo that we trained physician assistants, technical officer, disease control officers, medical laboratory technologists.
So you have more or less specialized nurses who have expertise in specialized areas.
That is right.
And you're saying yourself and over 500 of your colleagues will today be picketing at the Flagstaff house?
That is right.
Let's go back to your content. And what you're saying is that, yes, this is the system. You're done with school and then you're recruited into the system. What has been the response from government as to why there's been a delay?
Initially, there were issues of getting a license before you practice, which is becoming the norm now. Yeah, so there was the inception of Allied Health Professions Council. And if I'm to explain this, you know, the nurses and midwives are under Nursing and Midwifery Council. So this new council has come for other nursing programs that are not clinical in nature. And that is, we are talking about allied health programs. And that is why I mentioned medical laboratory technologies, disease control. So basically, these programs are public health bias. Unlike the clinical nurses, that is more of clinical. So this council came in and required that we register with them to get a license before work. So that was the excuse initially. So it got to a time that we were to write an exams, and then those who pass were those who were supposed to be given these licenses.
And has that been done?
We went through the process of writing the exams. It didn't even end there. We got to a point where we have to then pay to be licensed. That's after you have even passed the exams, you have to pay for the license. And that one, we have done that one also.
Let me get some clarity. You had to pay as a, do you mean that it was mandatory for everybody, or because the systems were not working well, you had to give something little, or you mean that you had to pay properly? That's the stated, procedure.
Of course, it's a stated procedure. It was an administrative, and of course we have receipt for these payments. Yeah, so these are not payments outside official jurisdictions. We have receipts to back this payment.
So you have been licensed and now you're ready to work, yet still you claim government has not come to your attention, has not come to your aid and listened to all your concerns?
That is very true. Yeah, that's very true, because after our licenses, our names were supposed to have been sent to Ministry of Health, and then we followed up to Ministry of Health because it was delaying over a period of time. We were not getting any responses. So personally and as a group, we have made several follow-ups to Ministry of Health to find out why. But we got to a point whereby we realized that we are spending over 10 months in the house. Ideally, after you are bonded, that is with the agreement with government, you are supposed to serve for a period of time before, when you satisfy that requirement of the bond, you can be allowed to work elsewhere. So we are very much limited by the bond. Okay, without the with the bond, you can't pursue any employment outside what government is supposed to give you. Those are the terms and conditions of the bond that we want to follow. Rather, unfortunately, it seems our employers don't want to also go by that bond. So it's the first time something like this is
but
happening.
one would say, are you not acting hastily? Because essentially it takes a while for these processes to be exhausted. You can't just finish school and expect that yes, everything is going to happen. And for the past few months or so, we know that there's been a few challenges as to absorbing some health professionals into the system. So why don't you give government some time? I mean, you are saying it's just been 10 months. Why don't you give them a few more months or so? Because typically it takes about a year for the process to be exhausted, right?
That is not so.
Okay.
That is not correct.
So how long does it take?
The last time graduates from our school were absorbed into the system, it took just 3 weeks after completion of national
So as soon as
service.
you're done with school, you are absorbed into the system.
National service, he said.
As soon as you are finished with national service.
Okay.
We finished school in 2014. So national service began September 2014 and ended in 2015 August. Those are the technicalities. But there are others who don't do national service because they do 2-year certificate programs. And they are not required to do national service. So at any point in time, we have more than 10 months from when we finished national service. And there are others who didn't do national service. And they have spent more time than us because we completed at the same time.
And you're all home now doing what?
Absolutely.
What are you doing?
We have become more of a burden to our families. Because you agree with me that in going to school, you need a lot of support from your family. It is not easy going through nursing training, and then for you to come out, and then now you have no job, and you have to come and rely on the same family who hitherto had supported for you to complete. Yeah, but also to make say something about your time with respect to we not acting in haste. You agree with us that we are more of in the same category with general nurses who were posted just last week, and they are over 4,700.
But they had to go through the same process.
It took a while for
We started the same process with them.
So you are saying because they decided to picket and all government paid attention to their concerns and got them absorbed, so you're also going to follow suit?
picket.
That is not so.
Okay. So what are you saying?
If we had actually wanted to follow them exactly, we made the resolution that because we are professionals, we didn't want to go to the extent of picketing.
But you are going to that extent, so essentially you're acting unprofessionally.
That is to say that we've been pushed extremely hard. We've more or less been pushed to the wall. So we are being compelled to do that because all avenues we've exhausted, and yet we aren't getting postings.
So you'll be picketing?
That's exactly
today.
Right. Yes. Starting today, let me make this very clear. We are going to start today picketing until our postings are actually released.
But
so it is going to take from today.
Okay.
So
throughout the
you're
entire
satisfied?
week. Yes. So it's not going to be a one-day picketing.
So you're going to start today. It's already drizzling or raining outside.
Either rain or shine, and yes, we are going to be there.
Quite interesting.
I quickly just want to find out from you whether or not you have the necessary clearance from the security apparatus to picket, particularly at a security zone like the Flagstaff House.
My brother, were nurses given security police permit before they went to picket there the last time? And are we the first group of people to go and picket? But to answer your question, we are still in process, and we have all the necessary requirements that would require that we picket.
So you've gotten the all clear from the police and all the other security apparatus. Is that what you're saying?
We have a lot of things we are doing. Okay.
No, I'm asking this now because you plan on picketing today, in some few hours time. So as of now, do you have all the necessary documentation, all the necessary clearance to embark on that action?
Yes.
You do?
Yes.
Okay.
So we are not going to hear of any arrests or the security apparatus coming out to say you're not supposed to be there. You're confident about
from how
that.
you speak, it suggests you are really bent on doing this, and rain or shine, by hook or crook, you want what is due you. Does that even mean fighting with the police if you have to? Just so you can drum home your point?
We are law-abiding citizens in the first place.
But if push comes to shove already, as you're saying now, you've been pushed to the wall, so you are acting unprofessionally. But
I would wish I wouldn't comment on that yet. So let's go through the processes. And for instance, I think you're a reputable media organization who has very far-reaching consequences. So from this time till the time we have agreed to go and picket.
What time is that exactly?
It's from 9 a.m. today.
9 a.m.
And it will take place throughout the whole week.
Okay. All right. Okay, so we'll see how that goes. We'll be keeping our eyes on that. We'll be following that very decision by these nurses, specialized, of course, to pickets at the Flagstaff house over government's failure to listen to their concerns and get them absorbed into the system. Or they are saying that they've been home for some time. He tells us himself and most of his colleagues have been home, some for a year, others for 2 years or so, and they have now become a burden onto their families, and they cannot stand that anymore. So for now, they would have no option than to picket at the Flagstaff house this morning at 9 a.m. We'll see how that goes, Menace.
We just thank you so much, Pascal Al-Hassan. He's the leader of the Coalition of Allied Health Professionals from the College of Health and Wellbeing in Kentampo. And like Chen Hine said, he's been talking to us about their struggles and why they decided to picket at the Flagstaff house today. And as he says, from today till they get their demands met, they'll be picketing. You're still watching the AM show. When we come back, we'll